Do you ever wake up in the morning and notice things aren't quite as they used to be? Especially when it comes to your intimate health. Perhaps you've experienced changes you don't fully understand. Or maybe you're just curious about how to best maintain your vitality and comfort as you age. It's a topic many men feel uncomfortable discussing, even with their doctors, leading to unnecessary worry or even overlooked health issues. This silence can create a real, nagging concern, making you feel less confident or even affecting your relationships. You might wonder if certain changes are just a normal part of getting older, or if they're signals that something needs attention. The truth is, paying attention to your body, especially in the mornings, can provide valuable insights into your overall health. What if I told you there are simple, yet incredibly important, morning care routines that can make a significant difference in your comfort, health, and confidence? These aren't complicated procedures, but rather easy-to-adopt habits that a urologist would recommend. They're about understanding your body's signals and taking proactive steps to support your well-being. In this video, we're going to explore 7 essential morning care tips for men over 60 straight from a urologist's perspective. These habits can help prevent common issues, improve your overall intimate health, and even give you a better understanding of what's happening down there. Get ready to discover practical, straightforward advice that can lead to a more comfortable and confident you. Make sure you watch to the very end, because some of these insights might surprise you. So let's dive right into the first essential morning care tip, one that might seem incredibly basic, but its importance, especially as we get older, cannot be overstated. Proper hygiene. Now, I know what you might be thinking. Of course, I clean myself, but there's a difference between a quick rinse and truly mindful, effective hygiene that addresses the unique needs of a man's intimate area, particularly after 60. As we age, skin can become more delicate, and immune responses might not be as robust, making us potentially more susceptible to infections or irritation if proper care isn't taken. The goal here isn't just about feeling clean, it's about preventing the buildup of bacteria, fungi, and other irritants that can lead to issues like balanitis, skin irritation, or even unpleasant odors. These problems, while often treatable, can cause significant discomfort, itching, and embarrassment, affecting your quality of life and confidence. Simple hygiene in the morning, after a night's sleep, helps to wash away any sweat, dead skin cells, or residues that may have accumulated, creating a fresh and healthy environment. So, now what does proper morning hygiene entail? It's about using mild, gentle cleansers and warm water. Avoid harsh soaps, perfumed products, or strong antiseptics that can strip away the natural protective oils of the skin and disrupt its delicate pH balance. These harsh chemicals can cause dryness, irritation, and even allergic reactions, making the area more vulnerable. Instead, opt for plain warm water, or a very mild, unperfumed soap specifically designed for sensitive skin, or even a specialized intimate wash for men. Lather gently, ensuring you clean all areas, including under the foreskin if you are uncircumcised. This area, in particular, can accumulate a substance called smegma, which is a combination of dead skin cells, oils, and moisture. If not regularly cleaned, smegma can become a breeding ground for bacteria and lead to inflammation or infection. After washing, it's crucial to thoroughly dry the area. Moisture trapped in folds of skin or under the foreskin can promote the growth of fungi and bacteria, leading to conditions like jock itch or yeast infections. Use a soft, clean towel and pat the area dry completely. Don't rub vigorously, as this can irritate sensitive skin. Ensuring the area is dry before dressing is a simple yet effective step in preventing uncomfortable rashes and infections. Think of it as creating a healthy, breathable environment for your skin. This thoughtful approach to morning hygiene lays the groundwork for preventing many common issues and maintaining comfort throughout your day. Moving on to our second essential morning care tip, and this one ties closely into the first, paying attention to daily self-inspection. This isn't about being overly obsessive, but rather about a quick, simple visual check that can become a powerful tool for early detection and prevention. As men age, It's particularly important to be aware of changes in our bodies, and the intimate area is no exception. Many conditions that might develop, if caught early, are much easier to manage or treat. Ignoring small changes can sometimes lead to more significant problems down the line, causing unnecessary worry, discomfort, or even impacting your overall health. Why is this daily self-inspection so important in the morning? Because it's a routine time when you're likely already in the bathroom, and it allows you to observe your body in a consistent state. Over time, you'll become familiar with what's normal for you, making it easier to spot anything out of the ordinary. What exactly should you be looking for? It's not about being an expert, but about noticing any new lumps, bumps, sores, rashes, or unusual discharges, and pay attention to changes in skin color, texture, or any areas of redness or swelling. Look for any persistent itching, tenderness, or pain. If you're uncircumcised, gently retract the foreskin to inspect the glands and the sulcus, the groove behind the head of the penis, for any changes. This habit is about empowering yourself with knowledge. It's not about causing anxiety, but about proactive health management. For instance, if you notice a new lesion or a persistent rash, it could be a sign of anything from a minor skin irritation to something more serious, like a fungal infection, or, in rare cases, even certain skin cancers. Detecting these early can make a world of difference in treatment outcomes. Similarly, changes in discharge could indicate an infection. Don't self-diagnose based on what you find. The key is simply to notice, and if you observe anything unusual or concerning that persists for more than a few days, to bring it to the attention of your doctor or a urologist. Think of this daily check as a regular maintenance routine for a valuable piece of machinery, just as you might check the oil in your car or look for unusual sounds. A quick visual inspection of your intimate area allows you to catch potential issues before they escalate. It's a habit that fosters a greater awareness of your body, promotes a sense of control over your health, and ultimately contributes to your peace of mind. By making this simple, quiet observation part of your morning routine, you're taking a vital step towards ensuring your long-term intimate health and overall well-being. Moving seamlessly into our third essential morning care tip, one that's often overlooked but incredibly impactful: paying attention to your morning erections. Now, this might seem like a topic reserved for discussions about sexual health, but morning erections, also known as nocturnal penile tumescence, are actually a very important indicator of overall vascular health and neurological function. Especially for men over 60, many men experience changes in their erections as they age. And while some decline is normal, persistent absence or significant weakening of morning erections can be a silent signal that something else might be going on with your body. Why is this important for morning care? Because the morning is a consistent time when your body has been in a relaxed state, allowing for natural physiological processes. These erections are not typically caused by sexual thoughts, but rather by cycles of REM sleep that stimulate nerve activity and blood flow to the penis. Their presence indicates healthy blood vessels and nerves that are functioning well. The absence of morning erections, or a noticeable decline in their frequency or firmness, can be an early warning sign of underlying health issues such as cardiovascular disease, diabetes, high blood pressure, or even neurological conditions. All of these affect blood flow and nerve signals, which are crucial for erectile function. It's like your body's internal check engine light coming on. It's a common misconception that erectile dysfunction is solely a problem of aging or a lack of desire. In many cases, it's a symptom, not the root cause. If you're experiencing a consistent absence or significant weakening of morning erections, it's not a sign of failure, but rather an opportunity to have a conversation with your doctor. This isn't about seeking immediate solutions for sexual performance, but about using this natural morning indicator as a diagnostic tool. Your doctor can assess your cardiovascular health, check your blood pressure, cholesterol, and blood sugar levels. They might also look into hormonal imbalances, such as low testosterone, which can affect not only erections but also energy levels, mood, and muscle mass. For example, a man who notices his morning erections are less frequent might discuss this with his doctor, who then discovers he has undiagnosed high blood pressure. Addressing the high blood pressure would not only improve his overall heart health, but could also lead to an improvement in his erectile function. This proactive approach allows for early intervention, potentially preventing more serious health complications down the road. It's a sensitive topic. Yes, but approaching it from a health perspective can provide invaluable insights into your general well-being. By simply noticing and acknowledging these morning signals, you are taking an active role in safeguarding your overall health, ensuring that your body systems are functioning optimally, and maintaining a better quality of life as you age. Let's now turn our attention to the fourth essential morning care tip, one that extends beyond direct penile health but profoundly impacts at maintaining proper hydration. This might sound surprisingly simple, but the truth is, many men, especially as they get older, don't drink enough water throughout the day. And this subtle dehydration can have wide-ranging negative effects, including on your intimate health. Think of your body as a complex system of interconnected parts, and water is the essential lubricant and transporter for all of them. Why is morning hydration so important? Because after a night's sleep, your body has been without fluid intake for several hours, making you naturally somewhat dehydrated in the morning. Starting your day with a good glass of water helps to rehydrate your system, kickstart your metabolism, and ensure that all your bodily functions, including blood circulation, are operating efficiently. And efficient blood circulation is absolutely vital for penile health. Proper blood flow is fundamental for achieving and maintaining erections, as well as for delivering nutrients and removing waste products from all tissues, including those in the penis. If you're consistently dehydrated, your blood volume can decrease, making your blood thicker and less efficient at circulating, which can contribute to issues like weaker erections or general sluggishness, beyond direct impact on erectile function. Adequate hydration also supports kidney and urinary tract health. As we age, men can become more prone to urinary tract infections, UTIs, or kidney stones. Drinking enough water helps flush out bacteria from the urinary tract, reducing the risk of infections, and helps prevent the concentration of minerals that can lead to stone formation. Starting your day with water helps prime this flushing system. Imagine a garden hose if there's not enough water pressure. The flow is weak. Your circulatory and urinary systems are similar. They need sufficient fluid for optimal function. So, how much water is enough? And how can you ensure you're getting it? A general guideline is around 8 glasses, about 2 liters of water per day, but individual needs can vary based on activity level, climate, and overall health. A great morning habit is to drink a large glass of plain water right after waking up, even before your coffee or tea. Keep a glass of water on your nightstand to make this easy. Carry a reusable water bottle with you throughout the day to sip on. Remember, thirst is often a sign that you're already slightly dehydrated, so try to drink consistently. Limit sugary drinks, excessive caffeine, and alcohol, as they can contribute to dehydration. Herbal teas can be a good addition. By making morning hydration a non-negotiable part of your routine, you're not just quenching thirst, you're actively supporting optimal blood flow, urinary health, and overall vitality, all of which contribute to your intimate well-being and a better quality of life as you age. Moving on to our 5th essential morning care tip, one that focuses on supporting healthy blood flow and nerve function through daily pelvic floor exercises. Now, when people hear pelvic floor exercises, or Kegels, they often think of women. But these exercises are incredibly beneficial for men, especially after 60, and they play a direct role in intimate health and function, just like any other muscle group in your body. The pelvic floor muscles can weaken with age, surgery like prostatectomy, or chronic straining. Weak pelvic floor muscles can contribute to issues like urinary incontinence, reduced ejaculatory control, and can even impact erectile strength. Why is focusing on this in the morning particularly useful? It's a quiet time when you can easily incorporate a few minutes of focused exercise. The pelvic floor muscles are a hammock-like group of muscles that support the bladder, bowel, and sexual organs. Strengthening them can improve bladder control, prevent accidental urine leakage, which can be a source of embarrassment and discomfort for many men, and enhance blood flow to the penis, which is crucial for achieving and maintaining erections. Think of these muscles as the pump that helps maintain blood flow to the penis. So, how do you do Kegel exercises? It's all about identifying the right muscles, Imagine you're trying to stop the flow of urine midstream, or trying to prevent passing gas. The muscles you clench are your pelvic floor muscles. Be careful not to squeeze your buttocks, thighs, or abdominal muscles. The movement should be internal and focused on the pelvic area. Once you've identified them, the exercise involves simply squeezing these muscles, holding for a count of 3 to 5 seconds, and then relaxing for an equal amount of time. Repeat this 10-15 times, aiming for 3 sets per day. The morning is an ideal time to complete one of these sets, perhaps right after you've emptied your bladder. Consistency is key with Kegel exercises. You won't see results overnight, but with regular practice over several weeks to months, many men report significant improvements in bladder control, stronger erections, and even better ejaculatory control. It's a discrete exercise that can be done anywhere, anytime. But making it a consistent part of your morning routine helps ensure you don't forget. This simple, focused exercise empowers you to take control of an often overlooked aspect of your intimate health, contributing to greater confidence, comfort, and a more fulfilling life as you age. Now, let's turn our attention to the 6th essential morning care tip. And it's about making mindful clothing choices right after your morning routine, opting for breathable underwear and loose-fitting clothing. This might seem like a small detail, but it has a surprisingly significant impact on the health and comfort of your intimate area, especially for men over 60. The environment around your penis and scrotum is sensitive to temperature and moisture, and wearing restrictive or non-breathable fabrics can create an unhealthy environment that fosters problems. Why is this important in the morning? Because it's when you're getting dressed for the day, setting the tone for the hours ahead. Throughout the day, especially if you're active or live in a warmer climate, the groin area can become warm and moist. Tight, synthetic fabrics like nylon or certain blends trap heat and moisture, creating a perfect breeding ground for bacteria and fungi. This can lead to uncomfortable issues such as jock itch, skin irritation, chafing, and even contribute to a less than ideal environment for overall penile health. It's like wearing a non-ventilated greenhouse for your sensitive parts. So, what are the best clothing choices for optimal intimate health? The answer is simple: natural, breathable fabrics. Cotton is your best friend when it comes to underwear. It's soft, absorbent, and allows for good air circulation, helping to keep the area cool and dry. Look for underwear that provides support without being overly restrictive. Boxers or boxer briefs made of cotton are generally good choices. Avoid tight-fitting briefs made of synthetic materials for everyday wear. Beyond underwear, consider your outer clothing as well. Loose-fitting trousers or shorts can further enhance air circulation and prevent excessive heat buildup. If your job or daily activities require you to wear tight clothing for extended periods, try to change into something more breathable as soon as possible when you get home. Similarly, after exercise, it's crucial to change out of sweaty workout clothes immediately. The goal is to minimize moisture and heat in the groin area, which are the primary culprits behind many common skin and fungal issues. By making these conscious choices in your morning dressing routine, you're taking a simple, proactive step to maintain comfort, prevent irritation, and support the overall health of your intimate area throughout the day, contributing to a better quality of life and reduced worry. Finally, we arrive at our 7th and perhaps most critical morning care tip, one that underpins all the others and is absolutely essential for comprehensive men's health after 60 regular communication with your doctor. While all the preceding tips focus on self-care and personal observation, knowing when to seek professional medical advice is paramount. Many men, especially in our generation, have been taught to be stoic and to avoid discussing sensitive health topics, particularly those related to intimate health. This reluctance can lead to delaying necessary medical attention, allowing minor issues to become major problems, and missing opportunities for early diagnosis and effective treatment. Why emphasize this in the morning? Because it's often during morning routines that you might notice subtle changes or have questions about your intimate health, whether it's a persistent ache, a new lump, changes in urination, or concerns about erectile function. These observations, if not addressed, can fester and cause anxiety. Your doctor, and particularly a urologist, is a trusted professional who can provide accurate information, perform necessary examinations, and offer appropriate guidance or treatment. They've heard it all before, and there's absolutely no need for embarrassment. Son, what kind of conversations should you be having firstly? Don't hesitate to discuss any new or concerning symptoms you've noticed during your self-inspection. This includes lumps, pain, rashes, unusual discharge, or persistent itching. Secondly, openly discuss any changes in your urinary habits, such as increased frequency, urgency, difficulty urinating, or waking up frequently at night to urinate. These can be signs of prostate issues, which become more common with age. Thirdly, if you're experiencing changes in erectile function, whether it's less frequent morning erections or difficulty achieving maintaining erections during intimacy, bring this up. As we discussed, these can be indicators of underlying conditions like heart disease or diabetes, and addressing the root cause is crucial for your overall health. Regular checkups are also vital, even if you feel perfectly fine. Routine visits to your primary care physician can catch potential issues early. Your doctor can recommend appropriate screenings, such as prostate-specific antigen PSA tests, and discuss any concerns you might have about sexual health or hormonal changes. Think of your doctor as your partner in health, someone who can provide objective advice and support. Overcoming the reluctance to talk about these private matters is a powerful step towards maintaining your well-being. By making open communication with your healthcare provider a consistent habit, you empower yourself with knowledge and proactive care, ensuring that you live your healthiest, most confident life as you age. So, there you have it. 7 essential morning care tips for men over 60, straight from a urologist's perspective, designed to help you maintain your intimate health, comfort, and confidence as you age. We started by emphasizing the foundational importance of proper hygiene, ensuring you're cleaning gently and thoroughly with mild products to prevent irritation and infection. We then moved to the power of daily self-inspection, a simple visual check that empowers you to spot any subtle changes early on, allowing for timely medical attention. Next, we delved into understanding the significance of morning erections, recognizing them as vital indicators of your overall vascular and neurological health, prompting a conversation with your doctor if changes occur. We then discussed the often underestimated role of proper hydration, highlighting how starting your day with water supports crucial blood flow and urinary tract health. Following that, we explored the benefits of incorporating daily pelvic floor exercises, or Kegels, to strengthen muscles vital for bladder control and erectile function. We also covered the practical importance of mindful clothing choices, advocating for breathable fabrics to create a healthy, dry environment. And finally, we stressed the most critical habit: regular communication with your doctor, encouraging you to overcome any hesitation and openly discuss your intimate health concerns for proactive care. Remember, aging doesn't mean resigning yourself to discomfort or decline. These are simple, practical habits that can be seamlessly woven into your daily routine. They're about empowering you with knowledge and giving you the tools to take control of your well-being. Small changes in your morning routine can lead to significant improvements in your comfort, confidence, and overall quality of life. Don't let embarrassment or misinformation hold you back from living your best life. Your intimate health is an important part of your overall health, and it deserves your attention and care. I truly hope that this video has provided you with valuable insights and practical steps you can start implementing right away. I'd love to hear from you. What are some of your morning routines or tips that help you feel your best? Or what questions do you have about intimate health as you age? Please share your thoughts and experiences in the comments below. Your insights could help other men who might be facing similar concerns. If you found this video helpful and valuable, please give it a like. It really helps our channel reach more people who can benefit from this important information. And, of course, make sure to subscribe to my channel for more practical health advice and tips on how to live your healthiest, most confident life at every age. Thank you for watching. And remember, live your best life at every age.